So let's start with the simple interaction at the heart of any healthcare system. What we want to do is facilitate an interaction between two parties. On the one side, we'll have a group we'll call patients, people who are sick, people who are injured, maybe people who are healthy but who want to get some preventive care, maybe people who'd like to ask a question or get some information, maybe people who have a concern about someone else they care about. On the other side of our interaction, we have a group we'll call healthcare providers. These are the people who can help the patients. Doctors, nurses, pharmacists, lab technicians, a pretty wide range of people actually. This group is normally people, but sometimes we'll also include institutions like a hospital or an imaging center. Sometimes it might make sense to include others, like for example, makers of healthcare goods and services like a pharmaceutical company or a medical device maker. The goal we have for this interaction between the patients and the providers is to have something that we'll call healthcare flow from the providers to the patients. We want the patients to be able to get help when they're sick, and we want people to be able to get prevention when they can benefit from that. We want people to be able to get their questions answered when that's what they need. So that's why we set up a healthcare system. We set up healthcare systems in which we can get healthcare from the providers to the patients in an effective and hopefully in a timely way. Now, we might be happy enough if we could stop there, but we can't really stop there because we need something to go back in return. The providers need to be able to get compensated in order to be willing to do this. If we don't pay them somehow, then providing healthcare won't be sustainable. We'll wind up with no healthcare providers, and that will be bad for our interaction. So we have to have a transaction here in which healthcare gets provided in return for some compensation. You might think of this picture as a map or a diagram of the interactions in a super simple healthcare system. In fact, this was the way that healthcare systems worked around the world, pretty much everywhere in the world, for pretty much all of recorded human history. You can go back thousands of years and find descriptions of and examples of where this is how healthcare systems, such as they were, worked. And it stayed pretty much this way for a long time. As recently as the late 1800s, into the early 1900s in a lot of places, this was basically how healthcare worked. And then events overtook it. And it became impossible to operate with just this model. Changes needed to be made. What happened? How did we move from having just a simple interaction or transaction to a modern healthcare system? We'll have to explore that some more.